To review, the drug takes over as survival at the level of unconsciousness. And the brain goes into a state of hypofrontality, where it's decreased cerebral blood flow, which prohibits the brain from functioning the way that it is designed to function. You'll see personality changes in a person. You'll see loneliness, isolation, denial, emotionally disconnected. You may start to see somebody with poor hygiene. You may see somebody who never lied before and was responsible. All of a sudden, they're starting to lie, keep secrets, protect their behavior, and not show up to life anymore. And they don't do that willingly. It's a symptom and a condition of substance use disorder. Tragic loss of insight or motivation, not seeking pleasure in things they used to find pleasure in, not putting priorities on responsibilities. Impaired decision-making, that's a result of the impaired brain functioning at many levels, which is further explained in the movie Pleasure Unwoven. And then lastly, continued use despite negative consequences. Now, if you can take a look at these with an open mind and say, my gosh, this is what a person experiences with substance use disorder on a minute-by-minute basis. And the drug at the subconscious level, the brain is calling for the drug for survival. I hope that you can understand substance use disorder as a chronic disease that requires ongoing maintenance and support and encouragement and an understanding of the disease and the diagnosis, where the 11 criteria are all behavioral. To quote Kevin McCauley, he says, addiction becomes a disorder of behaviors. We have had so much wonderful research over the past 15, 20 years through all the brain scans that have been done and the research that has been available to us now. I want to ask you to think about this. What if the only thing you ever knew about substance use disorder was that it was the result of genetics? How would you be thinking about it today? Would it change the way you interact with others? Would it change the way you treat your family members or loved ones? Would it change the way you look at people with addiction? What if the only thing you knew it was genetics? Well, today, scientific research has shown us that 50 to 75% of the likelihood that a person will develop addiction comes from genetics, or a family illness of family history of the illness. Exactly how genetics factor into addiction and what we could do to protect against their influence is something scientists are actively researching. Yay! We want to end this public health crisis and this misery for everyone. What if the only thing that you were told about addiction in your whole life it's not bad people making bad choices, is that it was environmental? Today, research indicates that adolescents raised in an environment where adult caregivers use drugs or engage in criminal behavior are at a significantly higher risk of developing a substance use disorder. Stable home life, supportive school atmosphere, and other protective factors have proven to reduce these risks. You can offset the negative with the positive if you know enough about it. If you see a child or anyone, and it does not have to be a child, if there's an adult whose social circle is one of criminal behaviors and substance use disorder or drug taking, the chances of that person falling into those patterns of behavior are very, very high. On the same note, when we see people leaving the criminal justice system and re-entering back into society, or we see people leaving a 28-day treatment, in today's system, they return to the environment in which they were in prior to them either going to treatment or entering the criminal justice system. As a result of that, the likelihood of them returning to use is extremely high. It's almost impossible not to return to use. As systems, which our systems are being worked on right now to improve, now that we have this education and information, right, to improve our resources that are available and to improve how we support people re-entering or leaving treatment. But I don't want to lose sight of the subject. What if the only thing you knew about addiction was that it was genetics and environmental? Would it change your thinking? Would it change the stories you tell? And lastly, what if the only thing you knew, was that it was developmental? Addiction can develop at any age. Research indicates the earlier onset of use, the greater likelihood exists that an individual can develop substance use disorder. And the longer we prolong the introduction of substances to young adults to use, that the better chances they have of not becoming addicted to substances. An adolescent's brain does not fully develop until their mid-20s, they say 25. Introducing drugs to the brain during this time of growth, before 25, can cause serious, long-lasting consequences. So part of the prevention mission is to educate youths on the risks of taking or trying or using alcohol or drugs earlier in their childhood. And we see this a lot in low socioeconomic environments, right? Where it is the environment. Drug taking, alcohol consumption, it is the way of life. Criminal behavior is the way of life. And how can we get better at improving these conditions for these individuals who were born into these environments? They didn't raise their hand and say, pick me, I want to be born into a low socioeconomic status. They were born into it. How can we as communities and society improve these outcomes for these individuals? So what if the only thing you ever knew about addiction was not its bad choices? It's not race or creed or ethnicity or socioeconomic status. It's genetics, it's environment. It can develop at any age. I did not start drinking. I have no history of alcoholism or drug addiction in my family at all, on maternal or paternal. And I started drinking alcoholically at the age of 42 to find relief from the absence of emotion and love in my own marriage. There was a lot of control and emotional and psychological abuse, which I had no idea what that was. And so at the age of 42, I started drinking to find relief. And by the age of 44, I had crossed the line. By the time I started drinking, my body was weak. I was not sleeping well. I was extremely stressed. I did not eat well at all. And so my natural elements for a healthy body were already depleted when I started to drink for relief. And so alcoholism took over me very, very fast within a matter of 2 years. I was a full-blown alcoholic with a lot of negative consequences associated with my drinking. Substance use disorder is a behavioral health condition. There's changes that take place in the normal biological chemical functioning of the brain. It causes damage to all brain levels. It impairs decision-making. It reconditions the brain's reward system to crave the drug for survival. It causes intense emotional distress, compulsion, obsession, 24/7, which causes a change in a person's personality and behaviors. Requires daily maintenance and monitoring, and for over a century has been shaped as a moral issue. What can you do? How can you help? Well, you already started to help. You're here, you're watching this series. You're improving your education and your understanding so that you can have better dialogue and change the narrative around addiction and recovery. And here's an important piece of information. Regardless of what your role is, this statistic was taken around medical information. But regardless of what your role is in the community, if you're a school teacher, if you're law enforcement, if you're a family court worker or a child welfare worker, the National Institute of Health reports that in one appointment, 40 to 80% of the medical information that was provided by the healthcare practitioner is forgotten immediately. Now, that's not for people with substance use disorder. That's for people without substance use disorder and quote unquote normal brain functioning. The minute you leave a doctor's office, most human beings forget 40 to 80% of what they told. Anybody ever have that happen to them? I know I have. It just happened to me yesterday. On top of that, the greater the amount of information presented, the lower the proportion correctly recalled. So you forget more if you're given more. And furthermore, almost half of the information that is remembered is incorrect. And a week later, you only remember 20% of what you told, and some of that's correct and some of that's not correct. Can you imagine what it's like for a person who's experiencing substance use disorder, cravings, and compulsion, being faced with the family court system, the child welfare system, law enforcement, loved ones, family members telling them, you need to do this, you need to do this, you need to go to treatment, you need to get a caseworker, you need to. It's not even possible for any one human being to recall all of the information that someone who's trying to get into recovery is bombarded with. So how can we change our own expectation of those that we're working with in the way that we deliver the information with empathy and understanding in an effort to support their progress? SUTTLE is an acronym that you'll hear about in the reuse prevention module. Seemingly unimportant behaviors that lead to empowerment. How can you help? Well, first of all, you can manage your stuff. Your personal experiences, your stigma, your biases, your personal experiences in the work that you do, if you don't manage them, only interfere and potentially harm the individual that you're trying to help. You've got to learn how to manage your stuff and look at the individual as a standalone individual with their own experiences not related to yours, and provide empathy and encouragement and understanding with each and every individual that you come across as just that, a unique individual. I will share a story with you. I had a guardian ad litem, and she worked our case for an excessive amount of time. I was in a very high conflict custody case where the father definitely wanted to destroy my relationship with my children and remove my parental rights. So this case lasted 4 or 5 years. And at the end of it all, there was one point where I couldn't understand why the guardian ad litem was not even having appointments with me, and I knew she was having appointments with my now ex. And so I asked for a new guardian ad litem. Well, my attorney got together with her and we had a meeting, and they said, give her one more chance. So I did. And all through the whole entire period of time, there were moments where I thought, why is she treating me like this? Like, I just don't understand why she's not hearing me, and why she's not helping me, and why she's not seeing a little bit of the world from my view. Well, at the very end of our relationship, she shared with me that her mother was an alcoholic, and that she could really relate to what my kids were going through because of her experiences. Well, folks, I can tell you that that bias severely impacted my children. It shaped them. It shaped their experiences. It allowed things to happen in the court that should have never been allowed because of her own personal biases. I was not the person that my ex painted me out to be, but she saw me that way through the eyes of her childhood. Speak about substance use disorder as a disease, not a moral failing. It requires ongoing maintenance. And you know what? When we think about ongoing maintenance, just like any other chronic disease, sometimes the medication or the prescription isn't right. It needs to be readjusted. Well, it's the same thing in recovery. Sometimes the pathway that the person is set on is not necessarily the right prescription, and it needs realigning and fine-tuning and readjusting. So break away from the idea that it's, the road to recovery looks like this, because it's different for every single individual. Support and encouragement like you would any other chronic condition. Understand there's brain functioning impairment when people can't make decisions, when people are struggling with behaviors, when people are showing up late. There's other brain functioning impairment going on. Explain the potential outcomes and explain them often. This reverts back to the slide that we saw about the medical health information. Understand that individuals speak slowly. If you're using terminology that is specific to your profession, the average individual doesn't know that kind of terminology. They don't know the abbreviations. They don't know the terms that you use. Explain them to them. Explain your expectations clearly. Ask them if they understand. Ask them to repeat them back to you. Let them know that you believe in them. This is really one of the biggest influencers in a person's sustainable recovery. It's very hard to imagine, but if you let somebody know that you believe in them when they don't believe in themselves, that goes a long way in helping move somebody into active recovery. Offer resources and offer different options. It's not just here's a treatment center or here's a detox and here's AA or NA. There are so many pathways of recovery that we'll look at in Module 5 that offer options. It helps give the person a sense of control. Most people experiencing substance use disorder live in a society where they're being told what they should do. And maybe they should do that, and maybe it would benefit them. But here's the reality about human behavior. People don't like being told what to do. People like to make their own decisions. You, me, the person sitting next to you. How many of you have ever done what you've been told to do? You fight it. It's human nature. Let's honor that in others. Connect with local recovery supports. Recovery community organizations are becoming commonplace in most states in this country. And I encourage you to explore, find out where those local recovery community centers are, find out where there's community action programs, where there's family resource centers. Get familiar with what's available. There is such a large number of resources available that you don't even know about. Explore. And lastly, celebrate successes, folks. If somebody stays away from a drink or a drug for one day, that's an enormous success. If somebody puts their phone, if somebody erases all the old phone numbers that are related to their friends or drug dealers in their phone, that's a huge, huge success. Oftentimes, if somebody starts caring about their personal hygiene, that's a huge success. All of these little, tiny, seemingly unimportant behaviors lead to success and lead to empowerment. Celebrate them. Be the change. Change the stories you tell. Change generations to come. Stop substance use disorder. Coming up in Module 2 is identifying common behaviors of substance use disorder and a glimpse at the reality of behavior change. So I hope you'll join me in that next module. I thank you for your time in this module of understanding addiction as a chronic disease. The additional material is listed and the links to the movie is listed down below. If you have any questions, please reach out to us and we'll see you at the next training. Hey there, this is Ginger. I hope you're learning a lot from this series. I'm asking for your help in supporting my tireless efforts. There's a few ways in which you can support me. Tell your friends about this video series, subscribe and like each video here on YouTube down below, make a donation on my website, or invite me to deliver this training in person. Together, we can all be part of the solution. Hope to see you soon, and thank you.